Amit N. Thakker is the chairman of the Africa Healthcare Federation and joins us from Kenya's capital, Nairobi, to discuss this. Amit, good to have you on this news hour. When we look at these 10 countries where this outbreak is happening, and of course it's sadly not unusual for some parts of Africa, what are the main driving factors behind this recent outbreak?
Look, we know that the infrastructure challenges have led to this outbreak. We have often talked about clean water, good sanitation, good hygiene, and frankly speaking, that's been the major reason of this spread. Vibrio cholera spreads quite easily, and then patient starts having watery diarrhea, and it moves from place to place. Boiling water, cleaning the fruits and vegetables, and making sure we have cooked food are all contributing factors. And coupling with this is the weak health systems. And that's what we have learned during the pandemic, that we need to strengthen health systems, we need to strengthen infrastructure, and we need to be better at tracking and controlling outbreaks. That's what's causing the problem.
And during the pandemic, we saw, of course, mass rollouts of vaccinations all over the world. I understand there is a vaccine for cholera, but is there enough of a supply right now of this vaccine to reach those who need it most?
Zambia had to wait quite a bit, but they've now received 1.7 billion doses. And one thing that is really good, it's not the vaccines that save lives, it's vaccination. And they've been able to get to 70% coverage. So we've become really good in Africa of making sure vaccines are given to the arms of patients. Do we have enough vaccines? No, we don't make vaccines. We have to wait for vaccines being brought. And that's why this is top of the mind agenda for all ministers of health and health champions in Africa, that we must make vaccines in Africa for at least consumption in Africa of 40%. For 60% of the vaccines by 2040. At the moment, we only make 1 or 2%.
Okay, so that is something that has to happen in the long term. How do governments start to fix what's happening now? Because there must be short-term solutions, immediate ones, and then, of course, the long-term strategies like actually fixing water sanitation and so forth.
So I think bilateral and global health partners are playing a central role in what you ask right now, solutions. WHO is right in the forefront of that model. Gavi and CEPI are other global health institutions who are making an extraordinary effort to ensure that the vaccines reach where it's supposed to reach. And then the challenge is to make sure that vaccinations take place in those countries. So global health partnerships are the main center stage right now.
Doctor, there are so many challenges, as you've just outlined there. When we look at some of those driving factors for the recent outbreaks, when it comes to something like climate change, has that become something that is also more prevalent because of the rains and the flooding that has also become more prevalent?
You see, yeah, absolutely. And that's why we had the climate change summit hosted here in Nairobi, talking about the weather patterns that are affecting health. Now, health must be on the main agenda of climate change. For a long time, health was left behind. I am so glad now that the health agenda is on the front of climate change discussions. We are very certain that when the glaciers melt, all sorts of pathogens will be coming through. When the floods and rains hit, it makes it even worse about getting communicable diseases. So we have to manage the degrees that everyone's talking about, but we have to manage the infrastructure to cope with this climate change.
Absolutely. Dr. Thakker in Nairobi, good as always to get your